Thank you for joining us for this episode of CNTV. I'm Brad Clonch along with Quin Tran.
We begin with the dedication ceremony for 3 new Chickasaw Nation medical facilities.
We would like to thank everyone for celebrating with us virtually for the ribbon cutting and opening of these beautiful new facilities.
This is the new COVID-19 Emergency Operations Facility located in Ada, Oklahoma. The 40,000 square foot structure serves as the COVID-19 Incident Command Center, a testing and vaccine site, and storage facility. This next building is the Chickasaw Nation Medical Center alternate care site. The single-story structure is 12,500 square feet with a large central nurses station, lab, and COVID overflow area. The facility will help to increase the Chickasaw Nation Medical Center's capacity to care for patients. And the Chickasaw Nation Medical Center Laboratory is a more than 11,000 square foot expansion of space for labs that include for microbiology, molecular biology, hematology, urinalysis, toxicology, and IV prep room.
As we have witnessed with all 3 of these projects, the Chickasaw Nation continues to press forward despite the obstacle in our path. Chickasaws have never been known to have lost a battle, and our current battle with COVID-19 is no different. We will beat this disease, and the facilities we are dedicating today will help us do that. Let us also celebrate our frontline workers who practice patient care with a Chickasaw warrior spirit. We pray for their continued fortitude to endure this prolonged battle and the strength to continue the fight against this threat to our community.
The Chickasaw Nation also held this virtual ribbon-cutting ceremony in February. The Hina Chokma Good Path Men's Recovery Center is located in Ada. The residential facility provides an individualized treatment plan for First American men.
The Hina Chokma, or Good Path Recovery Center, is a place where men in recovery can find a safe, supportive, and caring atmosphere. The goal of the Recovery Center is to break the cycle of addiction and to help individuals to learn the skills necessary to build strong families within their communities.
Each of the 2 residential units has 3 separate bedrooms with their own bathrooms. The units are connected to the large recovery center by a covered walkway. The Hina Chokma program started in 1984, helping countless people gain spiritual, emotional, and physical wellness in their recovery.
Now for an update on the COVID-19 vaccine. The Chickasaw Nation has administered more than 13,000 vaccinations. Tribal health officials have developed processes to deliver as many as 5,000 COVID-19 vaccines weekly as additional doses are received. This month, Chickasaw Nation Dental Services began helping the vaccination team.
We were very excited. When I went out to the dental providers and talked with them, I didn't have one person that hesitated. They were ready to be a part of that and to actually help with the fight against COVID. I mean, to potentially, this is pretty exciting time because it is that turning point that I like to say is that we're really going to see a big difference. And so each day that we're given those vaccines or we're being proactive in it, then we're going to see that we're going to be out of this pandemic and trying to pick up the pieces and carry on with what we have. And to be a more active part of that for dental, that is really exciting.
Numbers in our inpatient side have gone down. Our healthcare workers, we're seeing a decrease in the number of positive patients as we test our own. So it has to be having an effect, and we hope that we can share that good news and that effect with many others as we vaccinate the population.
Doctors are cautiously optimistic, saying people, including those who have received the shot, need to continue mitigation efforts. More of the population needs to be vaccinated. For the latest information on the COVID-19 vaccines and when you may get vaccinated, go to the web address on your screen.
Meanwhile, the Chickasaw Nation has conducted more than 100,000 COVID-19 tests. The tribe continues to make testing convenient, available to Chickasaw citizens and the public. The testing sites are located at the Chickasaw Nation Medical Center and health clinics in Ardmore, Purcell, and Tishomingo. People must pre-register online at covidtesting.chickasaw.net. For questions about the testing or test results, contact the number on your screen to reach the Chickasaw Nation COVID-19 call center. They'll be able to answer your questions. Healthcare officials are trying to learn more about the new strains of COVID-19.
We ask a Chickasaw Nation pediatrician about the variants of the virus and how that might impact children.
Well, I think I know about as much as the general public at this point. Obviously, from a pediatric standpoint, we're really fortunate that children, by and large, seem to be doing very well with COVID infection. We have, obviously, like everyone else in the country, seen lots of cases in both the young and old, and we are starting to see a lot of our school kids and our daycare kids as they're going back into those environments, being exposed to COVID-19 and obviously catching it as well. All the current literature suggests that children seem to fare well with the infection. So as far as the new strain goes, I've heard that what I have read indicates that it might be slightly more easy to spread, but no indication of increased severity of illness. So increased infectivity, but maybe not increased severity. And we'll hope that it stays that way.
How do we keep our children healthy, keep their immune systems strong?
So I think a lot of rest is really important for children and adults. But during this time, a lot of kiddos, I think, have really gotten run down. Kids, because they maybe aren't in regular school, they don't have to get up at the same time. They're getting their days and nights mixed up, and kids are playing video games into the night and watching TV. And so without having that regular routine, they're sort of slipping into maybe unhealthy sleeping habits. And so I have seen that a lot, that kiddos are, especially our preteens and teen population, are on social media and doing other activities till early in the morning, 1-2 o'clock in the morning. And then depending on what kind of online schooling situation they have going on the next day, they're having a difficult time performing there simply because of lack of sleep. Lack of sleep creates an increased level of cortisol, or stress hormone, in our body. And when that happens, it makes it difficult to fight infection. So I think anyone who's ever been through a very exhausting period in their life can reflect on that time and remember, I got sick with the upper respiratory infection when I was particularly exhausted. And it's because our immune system and our cortisol levels are very affected by our level of sleep. And so our kids are no different. They need that maybe even more so than adults because of the rate of growth that children are experiencing. And so, currently the AAP is recommending, up to 9-10 hours of sleep for kiddos instead of the 8 hours that we're all used to. And that's because of what they need for their metabolic rate, for their growth and their development, which is more accelerated than it is in adults.
Dr. Brogy says that sleep is important for both kids and adults. Sleeping well, eating a balanced diet, and lowering stress levels are key to boosting our immune system to fight illnesses.
The Chickasaw Nation has great resources to help us stay healthy during the pandemic. Explore chickasaw.net/at-home to learn more about medical news, fitness and wellness, culture, community, and more. See interviews with medical professionals and healthcare heroes. Get to know Chickasaw citizens and even try a new recipe from the Get Fresh cooking program. Find these resources at the web address on your screen. In our last episode, a Chickasaw Nation doctor shared what she and her team experience on the front lines.
We continue our conversation with Dr. Katie Burden-Greer. She tells us about her own recovery with COVID-19.
I started having symptoms of COVID-19 on November 21st. I know the way I got it was not from work. It was because my mom became ill with COVID. So I drove her down from where we live, about an hour 15 away, down to Chickasaw Nation to get treatment. So I'm sure, being in the car for 2.5 hours was quite a bit of exposure, even though, I wore a mask. It can still get through your eyes, through the mask even. At first it was body aches, fever, chills, and just generally feeling ill. A few days later, I lost my taste. I lost my smell. It was the strangest thing that everything I put in my mouth tasted like water, just no flavor at all. And after that, I started having the trouble breathing. I started having the cough, the shortness of breath, kind of couldn't walk across the room without being able to catch my breath. Chickasaw Nation had provided me with a pulse oximeter so I could watch my oxygen level. I'd say about 9 days into my symptoms, I had a really bad bout with the oxygen going too low. Honestly, I probably should have come to the hospital, but we all know healthcare workers are the most stubborn patients. So when my oxygen went down to 79, I actually used my albuterol inhaler. I'm asthmatic, so I used my inhaler a whole bunch and I laid on my stomach, which is called proning, which is one of the things we do with our patients in the hospital because it opens the alveoli, the lung sacs in a different way to help you get better oxygen. And, you know, between the inhaler and the laying on my stomach, I was able to get my oxygen back up to 89, 90% and avoid being in the hospital. So it took a long while before I could get good breaths again. Went back to work a couple of weeks later and was still so fatigued. I had trouble walking between my office and the ER. Had to take some breaks and ended up taking a little bit more time off. And I would say even now, I still get just a little bit short of breath. I'm much better and very thankful that it wasn't any worse. But I'm still not quite 100%, even almost 2 months out.
Through the experience of having COVID-19, do you relate even more so with your patients?
I would say so. I mean, I've taken a lot more time since I've recovered from COVID to ask them more specific questions geared towards what I experienced that I think they might not tell me otherwise. In particular, the side effects that you get from steroids are extreme anxiety, inability to sleep, and just general jitteriness. So I make sure that I ask all my patients to let me know if they're experiencing things like that, because, you know, we can give medicines to kind of counteract those side effects, whereas they might not normally say anything, because a lot of people don't like to admit that they're having anxiety or that they're having trouble sleeping. Nobody needs to get this disease, whether, you know, you're the lucky one that doesn't have very bad symptoms or you're the one that ends up in the hospital. There's no way to predict. I want everyone to stay vigilant, avoid crowds, wear your mask, wash your hands, and as soon as it's available to you, get the vaccine, because that's our biggest hope to try to move past this.
Dr. Burden-Greer recently received her vaccine. She recommends getting vaccinated even if you've already had COVID-19.
We'll continue to share vaccine news and give you insight from frontline healthcare workers in upcoming episodes. People drove by the Chickasaw Nation Medical Center to honk for heroes. The event gave the public an opportunity to show appreciation for the healthcare team. They are healthcare heroes who have worked long hours throughout the pandemic to care for patients and comfort their families. We thank all the healthcare heroes for all that they do.
We appreciate them so much. We'll see you next time here on CNTV.